Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve gets pinched. The sciatic nerve is actually a real nerve. You can see it comes down the back of the leg here, but it doesn't start out that way. It's actually a confluence of three nerve roots, L4, L5, and S1. Those are nerve roots that come out from the spine. They come together to form the sciatic nerve. Okay, 1 to 2% of the population suffers from sciatica at any one point in time. Most commonly it occurs because of either a herniated disc in the low back or something called spinal stenosis. There are some less common reasons such as nerve root irritation from degenerative disc disease, a tumor, or a problem after the nerve roots, meaning sciatic nerve is here and then there's something going on after the sciatic nerve is formed. How does it occur? When a disc degenerates, the outer layer may tear. So here's where normally the outer layer would be. If it's torn and the disc kind of herniates out here, it's called, in layman's terms, a slip disc. It can pinch the nerve root that's nearby. Okay, this in and of itself does not cause pain. It may cause weakness, but not pain. What happens is this causes inflammation, and that is what causes pain. Okay, so if you have a disc that has not herniated, for instance, maybe just bulging a little bit, but it has a tear in it, that can cause inflammation too. So even without pinching, you can get sciatica. Okay, so keep that in mind. If you don't see a big disc herniation on the MRI, it doesn't mean you're not having sciatica. It may mean there's just not a physical pinching. The symptoms of sciatica are going to vary. It may include a burning sensation or electrical sensation, pins and needles, frank numbness. Could also have some motor weakness, and then rarely a person will have incontinence. That becomes a surgical emergency. The diagnosis is generally from history and physical. It's often pretty common that you can make the diagnosis from that mostly. Here's an example of a physical exam test called the straight leg raise test. Straight leg raise puts tension on the sciatic nerve, and when you lift it up, it puts even more tension. It can be very, very painful. And then when a physician bends the knee, it takes tension off the nerve roots and the pain goes away. Okay, so that's very indicative of a herniated disc. An MRI is often the telling tale. So here you have a disc herniation that's very large. You see that right there? Okay. It may end up needing to have a nerve conduction study, or if it's a little bit unclear as to whether or not there is a reason for the sciatica, a diagnostic injection around the nerve root that's supposedly being affected may cause pain relief, and then you pretty much have an idea of there is some inflammation. Treatment may include limited bed rest. It used to be thought that a week in bed was good. We now know that's terrible. Anything more than 48 hours does more worse than it does benefit. Medications may include over-the-counter anti-inflammatories and Tylenol. And then prescription-wise, muscle relaxers can help, neuropathic medications such as Neurontin and Lyrica, possibly some short-term opiate medication. A Medrol dose pack is a 5-day course of prednisone. Should not be given a lot, but once in a while it can help dramatically to decrease inflammation. Physical therapy, chiropractic treatment can help. TENS units, such as you see here, can be very beneficial at reducing pain. Acupuncture has some research behind it, along with spinal decompression therapy. Interventional treatments, there are a couple that are really, really helpful. Trigger point injections are superficial injections that can help decrease spasms and aching. Epidural injections, such as you see here, are the gold standard for sciatica treatment due to a herniated disc. What happens is the pain doctor will inject the steroid medication in the area around the nerve root that's being pinched. Okay, that can cause incredible pain relief. It doesn't fix the problem, but if it causes relief for enough period of time where the person can avoid surgery and then this piece of disc disintegrates by itself, then you avoid surgery successfully. What are the outcomes with sciatica treatment? Over 95% of sciatica patients are successfully treated without surgery. There was a landmark study in Journal of American Medical Association in '06 that showed that 1 year outcomes between operative and non-operative patients identical. So if you can achieve pain relief with the non-operative treatments, that's great. Indications for sciatica surgery: you have to have surgery if you have cauda equina syndrome. That's when you start having incontinence of bowel or bladder. Then surgery is indicated within 24 hours. If you start to have muscle weakness, you shouldn't watch that for more than 6 to 12 weeks. It's unclear if it's ever going to get better, even if you have a successful surgery after that time period. We just don't know the black and white of how long to watch it. Sometimes you can watch it and it gets better within a few weeks. And the elective indication would be if you have 6 weeks or more of failed non-operative treatment, including such things as epidural steroid injections, physical therapy, pain medication, then the individual may opt to have surgery performed. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.